On today's The Doctor Is In, we're talking about surgery. If your doctor suggests that you need it, you should sit down and ask some questions before the procedure, not after. Dr. Scott Ackerman is one of the First Coast's leading doctors. He is here today to review some specific questions that you should ask. And this is important because, you don't want to go and talk to the doctor. You just want to, whatever you guys want, go through the procedure. But it's really good to have a firm grasp of what you're getting yourself into, obviously, before you find yourself in the position of having surgery. So, what do you think is important that patients should be asking their doctors?
It's important for the patient as well as the physician that a patient is well informed and knows what he or she's going to be going through before they do, because that way the patient knows what to expect afterwards, as you alluded to, and also the doctor doesn't have any surprise with the patient, and so it helps the doctor as well, so that, for the patient not to have any surprises. It's especially important in elective procedures. You have more time in an elective procedure to evaluate your options. If it's an emergency where you're brought in after a car wreck or something, all bets are off. But if it's an elective procedure, you really want to make sure you evaluate your options. You want to go to your doctor with questions so you can decide what's the best treatment for you. And I always recommend to my patients, as we've spoken about in the past, it's always good to bring a friend to, at home the night before your appointment. Make sure you sit down with your spouse or with a friend or with a child and talk about the procedure and what sort of questions you all might have, and then write down those questions so you don't forget to ask the question when you go see the doctor the next day.
All right. And what do you think the first question that patients should be asking their doctor, in your opinion?
Well, so, people ask me this question, and I ask patients sometimes, what do you think the best question is? And the questions that they come up with aren't necessarily the best question to ask. And so here's what I think are the best questions to ask, and the questions that you ask that will give you the answers that will help you make the right decision as to whether you should go to one surgeon or another, or whether to have the procedure done or not. So the first question is, what procedure is being recommended, and why is this procedure necessary? Is it surgery to alleviate some sort of pain, or is it some sort of surgery that's going to cure the problem that you're having? Is you going to take out my gallbladder? Is that going to rid me of any more problems with the gallbladder? Well, absolutely it will, because the gallbladder won't be there. But some surgeries only kind of do a temporary fix, but other surgeries actually repair something and make it all back to normal. Other question, risks, the complications. What are the risks of surgery? What complications can I expect? How will the surgery be performed? I just mentioned the whole gallbladder surgery. We used to do gallbladder surgery, and some places still do, some surgeons still do, and it's appropriate as well to do it with an open, where they would do a laparotomy, means they're opening up the abdomen, going in and taking out the gallbladder. Now they do it laparoscopically, where a scope goes in, a very small incision's made, and they go in with the scope and they look around, and they're able to take the gallbladder out through a very small incision, and the healing and recovery is much quicker. That laparoscopic procedure is appropriate for some patients, but the open procedure is appropriate for other patients. So you want to know from your surgeon how will he or she be performing the surgery, and make sure they explain the reasoning. Like I just explained to you, that you may think that going in for a gallbladder surgery that laparoscopic is the only way to go. And you see a surgeon, and the surgeon says, oh no, we're going to be doing an open procedure where we do an open laparotomy to evaluate. Well, there may be a good reason for that. And so you want them to explain the reason they're doing the procedure one way as opposed to another.
And I guess it's good to know the pros and cons too, of the procedure, what they think the good reasons and the bad reasons are for doing it. And getting a second opinion. We talked about this before on the show, where you say it's important to get a second opinion.
So you want to go over all the options with the doctor who's making the recommendation, be it a surgical recommendation or non-surgical recommendation, and you want to ask the surgeon, what options are there if I don't have surgery? Are there any medical options? And there are. We have patients that have bypass surgery for their heart, and there's other options that are non-surgical. Angioplasty is an option, medication is an option. So there's a lot of different options, but each one might not be right for everybody. Depends on each clinical situation, but you want to speak to the physician about the other options, surgical and non-surgical. And that's a good opportunity to seek a second opinion. And if the surgeon should gladly refer you to someone else for second opinion. If he or she is not, that's a red flag. But I have patients all the time see me, and they want to get a second opinion, and I usually make a recommendation. I give them a list of 2 or 3 people that I think are good, or that people that I would go to for me or my family. and that I respect their opinion, and I give them those names. They go to those people or not, depending on what they want to do. It's
At least
okay
they have
with
the
me.
option.
Right, they have the option, and then we come back and we talk about it some more.
Any other questions that you think are just important for people if they're going in to be getting any kind of procedure?
Well, if the surgeon's doing the procedure, you want to know how much experience he or she has had for this procedure and where they're performing the surgery, whether or not at that surgery center or hospital they do the procedure very often. I had a patient come see me, oh gosh, it was about 9 months ago, and she was going to have a tumor removed from her rectum, and the surgeon wanted to do it a special technique to do it. And he said to her that he couldn't schedule it for about he needs 6 weeks out because the hospital needs to rent the equipment to do the procedure. Well, she, needless to say, that would be a red flag.
Yeah, that would be a little one.
Right,
Yeah.
they actually not doing the procedure there very often if they have to rent the equipment for that day. So those are certain things you want to ask. How often is the hospital doing it? How often is that surgeon doing it?
You wouldn't even think to ask that question. I mean, you wouldn't think that you would need to rent equipment to have a kind of procedure done.
I was befuzzled by it.
Yeah,
I
would be
want the
too.
surgeon's board certified. You want someone who could bring their expertise to the operating room, and that expertise comes with board certification. It comes with having enough procedures done, like similar procedures, that it becomes second nature to the surgeon.
And where the procedure is performed too. I mean, we just talked about a place where you're having to rent equipment to get the procedure done, but where it's actually being performed is super important. I'm sure.
And it's not just the fact of renting equipment. If it's is the procedure to be done in a surgery or an outpatient surgery center, a hospital or an outpatient surgery center. If it's a minor procedure, it's okay to have it in a surgery center. For something more major, where there could be a difficult time with recovery, you may want to have it done in a hospital. You want to check the hospital's infection rate, that sort of thing, because that's where you're going to be recovering at the end.
Yeah, and last but not least, insurance. It's always important to check to find out where insurance, if it covers what procedure you're having.
It's always good to find out from your physician what are the expenses, what are my out-of-pocket expenses, what is insurance going to cover. Each insurance plan is different, and how they pay the surgeon, the anesthesiologist, and the hospital all will help you decide where you want to have the procedure done. And so you don't want to have any surprises later with a bill.
All right. Knowledge is power. Thank you so much, Dr. Ackerman. We appreciate you being here and sponsoring this segment. And for questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.